Well, this, of course, we know is the borderline. What was their main defense? Their main defense was splitting. So that was where you are either good or you are bad, right? So these are people that are unstable. They have mood swings, so they're impulsive. So if you're impulsive, what do? Well, you can abuse drugs. You can be sexually promiscuous. You can have problems with relationships. And what they have is that they have these chronic feelings of emptiness, or what they describe as emotional pain, okay? Emotional pain. And this emotional pain is so severe that what they want to do is have physical pain to sort of make it better. So how can I explain this to you? Imagine emotional pain here, right in your brain. The only thing I can think of, if you were to get a belt, okay, wrap it around your head and start squeezing really, really tight, what's eventually going to happen? Is it going to hurt? Squeeze, 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 like you're like this, squeeze, 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 squeeze. Eventually, you can't take it anymore. So what do? You cut. You feel the pain. You see the blood coming down. That makes you feel better. It's like, I feel so much better. And then eventually, it starts building and building and building, and you can't take it anymore, so you cut yourself again. So you don't cut yourself to kill yourself. What you do is to cut yourself to relieve yourself from this emotional pain. Exactly. Does this make sense to everybody? All right, that's what the borderlines do. If you saw the movie Fatal Attraction, she was a good, dramatic, over-the-top borderline. If you saw the movie Girl Interrupted with Winona Ryder, she was a more down-to-earth borderline. Remember, she had the relationship with her college professor, all the sexual promiscuity, and of course, the constant cutting. How can we affect this from schizoaffective? Because schizoaffective will not function, these people will. And very rarely will schizoaffective be the correct answer on the exam. So if you're itching to put schizoaffective down as an answer, I would be very, very careful. I would take a breath and I would look at that question again, because very rarely is that an answer. Okay. A 22-year-old man was recently arrested after setting his mother's house on fire. He's had numerous problems with the law, which started at an early age when he was sent to a juvenile detention center for his behavior at both home and school. He lacks schizoaffective disorder. Rarely on the test is it correct. Yes, so be careful with that. So this is a guy who sets fires and wishes his mother would have died. So what do we have here? The antisocial. They lie, they steal, they have no empathy, they have no remorse. They could be very cunning, they could be very charming. Usually starts before the age of 15, but you have to wait till the age of 18 to give them the diagnoses. If you saw the movie American Psycho, that dealt with antisocial. Dexter, the show, dealt with antisocial. Bernie Madoff, the guy that took everybody's money, I'm sorry, that's antisocial. So don't think of only antisocials being these serial killers. Think of all those people in Wall Street who know what they're doing and manipulating the markets so that they can make money. I'm sorry, that's antisocial too. Okay? So are we okay with antisocial? Society doesn't classify them as antisocial, but you know what? They are. A famous actor is outraged when a director questions his acting abilities during rehearsal for a play. The actor responds by walking off the stage and not returning to the stage unless the director apologizes publicly for the behavior. Do you have to have conduct disorder in children in order to get antisocial? Usually, yes. You don't wake up one day at 18 and say, I'm going to be antisocial. It's something that's brewing along. So you're just getting badder and badder and badder. So typically, do you always have it? Usually you do. Okay, so this, of course, is the narcissist. So they're grandiose. They think they're better than everybody else. They have very fragile self-esteem, though. And that's why they overcompensate and become the way that they are. They have no empathy, etc. Doctors, let's not only blame surgeons here. Doctors are infamous for this. Politicians, actors, etc. A 43-year-old man dreads an upcoming company holiday party because he believes that he's incapable of engaging in social conversation or dancing. He believes that he will become an object of pity or ridicule if he attempts such things. He anticipates yet another lonely holiday. Let me see. I read somewhere that schizoid and borderline are two personality disorders that lead to psychoses. Is this true, and how would it be tested? Not schizoid, it's schizotypal. So schizotypal and borderline can be psychotic, except their psychosis is short-lived, okay? So they're normal, they're stress, and then they become psychotic. Does that make sense? And it's not schizoid, it's schizotypal, exactly. Because borderlines, let me go to the whiteboard for a second. Where do you think the name borderline came from? Years ago, you were either neurotic or psychotic, right? So this is us. This hopefully is not us, right? They found a group of patients that fell right here. And what do you think they called it? Where does the name borderline come from? Because it's bordering between these two worlds. Okay? Okay. I don't think this is the same thing as the Madonna song borderline, so don't get the two confused. So what do we know about the avoidant? The avoidant is the one that their main problem, hold on, let me get something to write with. Their main problem is rejection. What if I get close to you? You're going to embarrass me. You're going to reject me. I can't tolerate it. So rather than look out, get friends and potentially be embarrassed or humiliated or rejected, I just won't. So I'll have few friends. I'll have few relationships. I kind of show restraint. They're very sensitive to criticism. Charlie Brown. I think Charlie Brown is a perfect example of avoidant. Good grief. Right? He's always afraid. Lucy's going to take that ball from him. People are going to say things to him. So he's not really out there. So that's Charlie Brown. Okay. A 26-year-old man is brought into the emergency room after sustaining several rectal lacerations during a sadistic sexual episode with his partner. The patient is extremely concerned that the police not be informed because he doesn't want to upset his partner and cause the partner to leave. So why are you in a relationship where you are being abused? What is that about? Well, because you are dependent and subordinates their needs for those of others, they're unable to make decisions. They constantly seek advice. They constantly need reassurance. So because of that, in their mind, they would rather stay in a bad relationship than basically go out and have to venture on their own and make decisions on their own, okay? So that's what the dependent is all about. Are we okay with this one? So usually people that, can this coexist in abuse victims? What coexist? Are you talking about like S&M? Is that what you're talking about? Are you talking about this? Oh, you mean one depend on the other? Yeah. You can have codependency, right? So one can depend on you and the other one can depend on the other one. Yes, definitely. Okay. And last but not least, a 37-year-old woman seeks psychotherapy as a result of an impending divorce. She says that her demands that the house be kept spotless, that extremely detailed and fixed work and the recreational schedules be maintained, and that rigid dietary habits be observed have driven her spouse away. Of course, I would leave too. So, this is the obsessive-compulsive personality disorder. These are the ones that, according to Freud, are fixated or stuck at the anal stage of development. What's unique about the anal stage of development? That's where we deal with control. So these are individuals that are control freaks. They're rigid, they're orderly, they're perfectionistic, they love rules, they love regulations. It's my way or the highway. These are the best lab partners. Why are they excellent lab partners to have? Because you don't need to do any work. Why is that? Because they know that whatever you do is going to be wrong. So they'd rather do it all from the beginning because that way they don't have to check it and redo it. Make sense? So what confuses all of you? What confuses, well, all is a strong word. What confuses some of you, that's better, right, is the following. What is the difference between OCD versus OCPD? What is the anal stage of development? That was a stage, according to Freud, between the ages of 2 and 4 that dealt with toilet training. So Freud believed that if you had very strict toilet training, then as an adult, you would be a control freak. That's what that is. So if you give me a minute, I'm going to put it in a text box because that way it'll be better. So what do we know about OCD? Oh, that's too small. OCD is an anxiety, oops, sorry, I spelled it wrong. OCD is an anxiety disorder, whereas OCPD, sorry, is a personality disorder. OCD is ego dystonic, meaning you hate the way that you are, whereas the OCPD is ego syntonic, which means you're okay with how you are. The people who have OCD do not function. The people who have OCD function. The people who have OCD have thoughts and rituals they cannot control. The people who have OCPD do not have thoughts or rituals they perform. They are just cheap, rigid, orderly, perfectionistic, etc. Okay? And this one you treat with SSRIs, and this one you treat with therapy. Monk The detective has OCD, and Monica has OCPD. Cheap meaning not giving. They don't like to give of themselves. Not necessarily this cheap, but emotionally cheap. Egocentric means you are okay with yourself. So this is not okay. You hate the fact that you have to wash your hands 1,000 times. This one, you're okay with the fact that you are. Does everyone understand the difference between these two? If you read the word quickly and you don't read the last part of it, you could get the question wrong. So this is what you have to be careful with, that very last word. Monk, the detective from TV. Explain passive aggressive. Oh, I'm sorry. I'm sure people were copying it. Passive aggressive is an individual who expresses their anger in a passive way. That's what that is. Exactly. You got it, Jose. So, are we okay with the personality disorders? Not showing up for appointments is passive aggressive. Exactly. Or making you wait before I turn the camera on might be passive aggressive. For those, oh my God, you don't need to know any neurotransmitters for personality disorders. They're not dealing with personality disorder. Neurotransmitters have nothing to do with personality. Mutism is a form of passive aggressive? You mean like girls who have selective mutism? I mean, it can be. It doesn't have to be, but it can be. All right, so if everyone understands these things, then let's go on a break, and I'll see you in 10 minutes. Or maybe I'll say 10 minutes and I'll actually see you in 11 minutes. That's me being passive aggressive again. All right, take care. See you soon. See you in 10. All right. Hello, everybody. Can you hear me and see me? How's everybody doing out there? Okay, one more chapter. Are all of you doing okay? Is your brain okay? Is your brain fried? Okay. Give me 1 second. Let me text something. Okay. Let me ask you something. Do you want to do a kind of light chapter for the last part of the night? Do you want to do chapter 16? And then we'll do the other one tomorrow? Because to be honest with you, my brain is kind of fried too. I don't know why. So let's skip one chapter, and then we'll start with a fresh brain at, I don't know how fresh our brain can be at 6, but it'll definitely be fresher than what it is now. What I'll probably do is that tomorrow I'll start with the chapter on the medicine, so our brain is at least most awake, and then we'll do the rest of the chapters, okay? Okay, so let's do not sleep, because sleep is high yield, and I'm really struggling, and I think all of you could be struggling. Maybe I'm projecting. This is a nice, fun chapter. It's very light. It's not that high yield, and I'd rather... Excellent. So let's get that chapter up here. Okay, great. So we're going to do this chapter, and you're off. And you could go practice sleep then. Okay, so what can I tell you about this chapter? Let me get some color here. You all know what I'm doing when I say let me get some color. You know that I have to click on certain things, right? So I'm wondering, what the hell is she doing when she's telling us this? Okay, this is, I'm going to say it's low yield. Only because, now remember, when I say low yield, doesn't mean don't expect it. I mean, you might get a couple of questions on it, okay? So let's begin. I want to start off by you understanding basic definitions. Because if you understand these definitions, everything is going to fall into place for understanding these things. So what is the definition between sexual identity and gender identity? Sexual identity is based on your secondary sexual characteristics. So what does that mean? If you have a penis and you have a lot of body hair, then you are a male, right? If you don't, then you are a female. So sexual identity is more of the biological part of you. Gender identity is your own sense of maleness and femaleness. It's established by the age of 3, and it is not determined by parents. The research has shown that the parents have nothing to do with this. This is something that's innate. This is something that's biological. This parent business was thought of because of some research. Actually, the researcher, which kind of was shady, and he sort of made things up. So understand, here, let's go to the whiteboard, because I think that's how it works best. So we are born with a certain body, right? We are born with a certain body. That body is your I sort of drew you like a little T-Rex with tiny little arms. So your body is your biological part. Then you've got your brain, which is what you think you are. For the majority of the people on this planet, gender identity and sexual identity go together, right? If you were born with a girl body, then you think you're a girl. If you were born with a boy body, then you think you're a boy. There's a small group of people who have a disconnect between the body that you're born with and what you think you are. And that's what's called, used to be called gender identity disorder, and it is now called gender dysphoria. So there's a disconnect in those group of people. So gender identity is the one that determines your gender role as well as your sexual orientation. So gender role, if you look at the definition, is what you do based on what you think you are. So if you have a tea set and you wear pink and you do little girl things, then what is your gender role? Your gender role is a female. But if you play with trucks, climb trees, and do little boy things, then your gender role is male. Everyone agree? Okay. Then who you are with is, again, determined by your gender identity and what your sexual orientation will be. So it depends on whether it's a male or a female. So now that you have the basics, let me get some other color in here to change it. Okay, so here's one example. So what kind of question do they ask here? What they want to ask traditionally is that they'll give you examples, and what they want to know is what's the sexual orientation. And the reason they want to know that is because this part can be confusing. So how does this work? If you are a biological male, right? But you believe you are a girl, what is your gender role going to be? What do you think? You are a biological boy, you're a boy, you believe you're a girl. What will you probably do? You will probably do what? You will do girl things. Does everyone agree? Okay. If you are in love with a man versus a woman, then you tell me what your sexual orientation is going to be. So if you are a biological male, you believe you're a female, and you're attracted to a female, then what is I'm doing this one first, what is your sexual orientation here? This one. You are homosexual, exactly. But if you're attracted to a man, then what is your sexual orientation? Then you are heterosexual. Does everyone understand this? What people do is that they look at this to determine sexual orientation. This does not determine sexual orientation, so we're going to cover it. We're going to put a loincloth on you, or we're going to put a skirt on you because you think you're a girl, okay? So you got a skirt. It doesn't matter what's under the skirt. Forget about it. All that matters is what you think you are. So if you believe you are a woman and you are attracted to women, that makes you homosexual. If you believe you're a man, if you believe you're a woman and you're attracted to men, that makes you heterosexual. Did everyone you want a fig leaf? I don't think I could draw a fig leaf. As you can see, my artistic skills are pretty lacking. I could draw a skirt. So do you want another example of this? Okay. Let's use another color here. Here, let's use pink. Transgenders can be homosexuals, but the majority of them are not. So RuPaul is different. RuPaul is not a transgender. RuPaul is a gay man, which is different. RuPaul knows he's a man. RuPaul chooses to dress as a woman as a performer. So what percentage of homosexuals have this disorder? Very small. Extremely small. This is Chaz Bono, exactly. This is Chaz. This is her. No, it's not called a disorder anymore. It's now called gender identity dysphoria. So let's do another one. If you are a biological female, right? Well, you believe you're a man. What would be your sexual orientation if you are attracted to women? Do not focus on this. Focus on this. Then, if you believe you're a man and you're attracted to women, you are hetero. But if you believe you're a man and you're attracted to men, then you are homo. Does this make sense to everybody? Most gender identity dysphoric people are heterosexual. So the majority of them are heterosexual. But can there be gender identity dysphoria homosexuals? Sure, why not? Listen, anything is possible in this world. So yes. Does everyone understand this concept? Like I said, people look at this, not important. Okay, so if we got the basic definitions, let's go back to these slides. Do you think I should have been an artist? I could have my paintings hanging in some museum one day? No. Have you ever seen the paintings by serial killers? Well, they're just as bad as mine. Okay. Gender role I went over. Sexual orientation I went over. Okay. Let's talk about more fun facts in human sexuality. One thing that we don't like to use in psychiatry is the word normal. Why? Because what's normal for me is not normal for you, is not normal for Jose, is not normal for Fabio, is not normal for Maria. So we're all different. So we try to stay away. The only thing that we would consider abnormal, right, is if it affects other people. If because of what you do, you're causing a dysfunction in your life or in someone else's life, then it becomes a problem. So as far as masturbation is concerned, what do you need to know? Everybody does it. Little kids do it. Adolescents do it. Married people do it. Everybody does it. When little kids do it, there's nothing sexual to it. And for those of you that have kids and things like that, you got to understand that, you know, they touch themselves, they like it, but there's nothing sexual. But as they get older, then it becomes sexual. So is there such a thing as too much masturbation? What do you think? Is there such a thing as too much? Only if it affects your functioning. Like I were to say to you, let's go on a break right now. Gotta go right now. Then you will say, wow, she's got a big old problem that she cannot wait 38 minutes. Well, I can wait, so I don't have a problem. So let's move on. Okay, so we talked about that. Only if it interferes with that is it a problem. 37 minutes and counting. Okay. Homosexuality. We know that it's not a mental disease. It was taken out of the DSM. What causes it? Who knows? They think it's biological. Again, this is a theory. It's not a fact. They think it could be genetic. Why? Because you see more among monozygotic than dizygotics. So what could they ask about this? Typically the questions that they ask about homosexuality is, do they have greater incidence of mental illness than the general population? No, of course not. Equal amounts of anxiety, depression, etc. As far as the relationships are concerned, the male-male relationships versus the female-female, I think female-females tend to be a little bit more socially acceptable than the male-males, and they tend to be a little bit more stable as well. You want me to repeat masturbation? Oh, wow. So what you need to know, that didn't sound right, did it? No, it did not sound right. Let me repeat it for you. There's no such... It only becomes a problem if it interferes with your functioning. So for the test, you just put in, everybody does it, men do it, women do it, boys do it, girls do it, babies do it, grandma, grandpa does it. There's no such thing as what's normal, only if it affects your functioning, okay? Okay. So what kind of question do they love asking on this? This is what they like to do. A popular question is that you come home early and you catch your 15-year-old son showering with the 15-year-old male neighbor, okay? So you catch your son with another boy, or you catch your daughter with another girl. What they want to do in that question is that they then are going to ask you, what do you tell the parents? That's going to be the focus of the question. Do you A, tell them that this is normal, this is part of adolescent experimentation? Do you tell them B, that you need to take them to therapy? Or do you tell them C, your child is a homosexual? The answer that you put, please, you don't have to believe in what I'm about to tell you. You just have to think about this when you answer the questions on the exam. The answer on the test is normal, okay? During adolescence, it is normal to experiment. So just because you experimented doesn't mean that you are homosexual. Now, if they were to say, you interview your son, or the doctor interviews the son, and the son says, look, this is all I like, this is all I want to do, this is the only thing that makes me happy, then what is the correct answer? Then C, correct, is the correct answer. But then that question's kind of easy. That's why this question's a little bit harder. So let me tell you, what every age do you take it all over the world? We know that people take baths all over the world and they take it together, but what they're assuming here is that something sexual is going on, okay? So this is a sexual bath. More than just a bath, exactly. Okay, so are we okay with this one? All right. Then when we talk about the sexual dysfunctions, what they've done is that they've divided them into the stages that they're in. So you have the desire phase, and that's where you think about sex, you fantasize. Then you have the arousal phase, where you have the physiological responses to sex. whether it's excitation, so it would be erection for men, and lubrication for women. Then you have the orgasmic phase, where you then have orgasms for both men and women. And then you've got pain. Now, these disorders can either be psychological or biological or both. So it could be medications, for example. It could be medical disorders that could be doing it. Or here, it could be fear, right? It could be religious beliefs. It could be upbringing. So if you're taught from early on that good girls don't enjoy sex and that only bad girls enjoy sex, then maybe you might have issues with sex because you don't want to be a bad girl. Okay? So let's review them. In the desire phase, that's where you think about it, you want it. And there's two disorders: hypoactive sexual desire disorder and the sexual aversion disorder. Hypoactive is where you probably have had sex, but it doesn't rock your world, okay? You might do it, but you're really not into it. Sexual aversion is that you'd rather not do it at all. So you'd rather be dead than do it. So those are these two disorders. There's a tribe somewhere that believes the vagina has teeth. It's called vagina dentata. So if you believe that the vagina has teeth, what disorder are you going to have? Scary, right? That one, right? You're not going anywhere near there. And aversion with a big old capital letters. Exactly. Then you've got the treatment of these disorders is either psychotherapy, and that's because this is all psychological probably. If it's a medication, then you switch to medication. Then you have the arousal phase, where you basically have the physiological response. So in female sexual arousal, these are women that can't have lubrication. So maybe it's psychological, or maybe it's physiological. Maybe it's a medication. For men, it's impotence or erectile dysfunction. So what we need to do here is figure out, is this organic or is this psychological? And one way we could figure it out is that we know that in REM, men have penile erections. So what we try to do is that we're going to monitor them to see if they have erections while they are in REM. And there's two tests for this. One is the postage stamp test, right? And the other one is nocturnal penile. This should be in your notes. Tumescence plethysmography. So the postage stamp test, I actually found, what did I do with it? I actually had like a little roll of stamps here that I found the other day. Here we go. So what you get is that you get a roll of stamps. I don't even know how old these stamps are. You get a roll of stamps. Hold on. And you adhere them to the penis. So you get the roll and you adhere it to the penis, right? So if he has an erection, the stamps are going to break. And then you know that it's not purely organic and there must be some psychological component. So the nocturnal penile tumescence plethysmography is a fancy test. You go into a lab, they hook you up to machines, and then they determine whether or not you had an erection, okay? So that's one way. And if you did have an erection, then we know that the problem is probably more psychological than physiological. And the number one cause of impotence in men that it's medical, it's diabetes, always. Do they really do this, the stamp test? Yes. They do it. And then we have the arousal. Oh no, the treatment. We did that already. Then we did that already. I'm just getting ahead of myself. Then we have the orgasmic disorders. So you've got female orgasmic disorders, and for men, it's premature ejaculations. For females, so these are females that are unable to achieve an orgasm even with masturbation. So what you do is basically teach them about their anatomy, teach them about vibrators, masturbation, etc., and then they eventually get it. Premature ejaculation is when the man ejaculates either just as he enters the vagina or before he enters the vagina. And this is typically due to anxiety about the sexual act. So what we do here is that we got to treat it. So one way of treating it will be either behavioral techniques or we use medications. If we use behavioral techniques, there's two techniques. One is the stop and go, and the other one is the squeeze. In the squeeze technique, the partner stimulates you. When you're about to ejaculate, the partner squeezes the glands of the penis, and therefore that should stop the ejaculation. Then they stimulate you again, then they squeeze. Those fingers were scary there, weren't they? The stop and go is that you are having sex, you are thrusting when you're about to ejaculate, you stop, then you start again, then you stop. So what you're doing here is really causing a delay in the ejaculation, which is what you want. It's not going to cause retrograde, it's going to cause delayed ejaculation. And that's what you want, because here in premature ejaculation, it's too fast. So that's why you want to make it slower, okay? And if not, you're going to use the SSRIs, because a side effect of the SSRIs is delayed ejaculation, okay? And then you've got the pain disorders, you've got dyspareunia, and then you've got vaginismus. Now these two have different names, and this name is eluding me. The new name for vaginismus, I think it's called pelvic insertion. What I'll do tomorrow is I'll get you the new names. So let's just review it now, and tomorrow when I give you these names, I'll go over them again. So these are women who just have pain, but it's purely psychological. So it's probably something in their brain that makes them think they have pain. So they have pain during intercourse, or vaginismus is involuntary constriction of the outer third of the vagina, preventing penile insertion. Okay? So can all of you hear me and see me? So this one, again, it's therapy, because these are women who probably fear sex. Maybe they fear impregnation. Maybe they've been raped. So there's certainly psychological causes going on here. Okay. And the treatment will be, of course, dilators. A paraphilia. Paraphilias are not called paraphilias anymore. Now they're called paraphilic disorder. That's what it's called. So a 20-year-old man was caught outside his neighbor's window looking in a Sheetis Road. Before his arrest, he would wander the subway stations and rub himself up against women, as well as expose himself to women who were nearby. All of these activities produced great pleasure in this patient. That's what the paraphilic disorder is all about. So these are individuals that basically, if this one here, hold on, if this is due to medical causes, then we, the psychiatrists, will not call it dyspareunia, okay? So this is purely psychological. So if you have pain because of lack of lubrication or something, maybe surgery, menopause, or whatever, we're not going to call it dyspareunia. And again, it's not called dyspareunia anymore. It's a long name, and the name totally is out of my brain right now. So I will tell you what the new name is. Vaginismus, I think, is penetration disorder. I think that's what it's called, but don't quote me on these two names, because these really changed in DSM-5, and I'll give you the new names tomorrow. And I think that's probably the reason why they changed these names, so not to confuse it with any gynae problems. Thank you. Genitopelvic pain and penetration disorder. Thank you very much. So let's go back. Let me write that in there. So dyspareunia is now called, let me use the text box. Hold on. Genitopelvic pain disorder. Doesn't that sound fancy? And vaginismus is called penetration disorder. Now that one sounds scary. So dyspareunia is genitopelvic pain disorder, and this one is penetration disorder. Yeah, it is fancy schmancy, isn't it? All right, so let's move on. So what is a paraphilia? A paraphilia is a disorder that basically is insistent, it's repetitive, it's lasting more than 6 months, and it causes impairment. So because of this disorder, you're missing work. Because of this disorder, you're not functioning well. Because of this disorder, this is the only thing that you like. And typically these disorders affect one of these three things. So for example, anything involving humiliation or suffering, that's where S&M comes in, sadism and masochism. The use of non-living objects, for example, fetish. Use of non-consenting partners, for example, the voyeur. So usually when you break down all these paraphilias, it's going to be linked to one of these three things. Can you explain the basic between the two and how? I don't understand the question. You mean this vignette? Oh, I see. We're back here. This one is just pain. That's all it is. This one, you are unable to achieve penetration. So what happens in vaginismus or penetration disorder is that the vagina constricts, so it doesn't let anything in. Is that what you're asking? Okay, so the fact that nothing goes in is the penetration disorder. Here it goes in, but it hurts. Okay, make sense? Okay. So paraphilias or paraphilic disorders is definitely affecting more men and women, usually young. And usually they have more than 3 to 5 of these things, so it's very common to have a whole bunch of them. So let's talk about, what are they going to ask you here? All they're going to ask you is the different types. So they'll give you a story, and they want to know what it is. So the exhibitionist is the flasher. That's the one that goes around exposing himself, like, ah, and he exposes himself. You know, like in the, have you ever seen that show Girls Gone Wild? Where they're all drunk in Mardi Gras or whatever, and they lift their tops? That could be a type of exhibition. Yeah, Miley Cyrus. Something's wrong with that chick. Fetish is using non-living objects like a pantyhose, like a shoe, underwear, a foot. The frotteur is the one that rubs up against you. So a busy subway station, bus stop, they come behind you, rub, 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 and within seconds they have ejaculated. The pedophilia, unfortunately, is the most common. Typically, the victim is under the age of 13, meaning prepubescent children. What turns on these pedophiles is that the kids are still kids. Once they develop their secondary sexual characteristics, they're not attracted to them. The voyeur is the peeping Tom. That's the one that's looking in through the window as you're taking your clothes off. The masochist is the one that likes to receive pain, likes to be beaten, likes to be bound. The sadist is the one that likes to do it, likes to tie you up and everything. So if you see the words S&M, that means sadism and masochism. So this one likes to beat you up, and this one enjoys it. The transvestite fetish, this is popular. Why? Because when we hear the word transvestite, we think of who? RuPaul. And if any of you know who RuPaul is this big old drag queen who's a gay man, and he dresses as a woman because he's a performer. This is not, I don't think Cher, well, there's many Cher drag queens, that's for sure. The transvestite fetish is a man who's not a homosexual, who wears women's clothing for pleasure. So maybe the police officer has the silk panties or a teddy underneath his uniform. That's the transvestite. So what they ask here is, what is the sexual orientation of the transvestic fetish? And you always say heterosexual, okay? Make sense for everybody? Okay. Gender identity disorder is not called that anymore. Now it's called gender identity dysphoria. Okay. So Billy, a 5-year-old boy, was found in his parents' bedroom wearing his mother's clothes. He's been observed going to the bathroom to urinate while sitting on the toilet, as well as playing with dolls instead of his trucks. He prefers to wear dresses and hates being a boy. So Billy is a biological boy, but Billy believes he is a girl. So what do we call that? Gender identity disorder? Or dysphoria, I'm sorry. So this is seen more common in boys and in girls. They don't know what causes it, but again, they think it's biological. Parents have nothing to do with it. Does this happen in boys who have... No, it has nothing to do with that. Nothing at all. So these are kids basically as they're growing up and they're developing. The girls are going to want to bind their breasts and boys are going to hide their penises. They'll take hormones to deepen or soften the voices. And then these are the ones that end up in sexual reassignment surgery. Understand that this is not, there's X amount of facilities all over the country that do the surgery. And for you to get the surgery, you've got to be pre-approved. So you've got to go to therapy. You've got to have certain guidelines that you have to complete. Okay? If you saw the movie Boys Don't Cry, this is this. If you saw the movie Transamerica, this is this. Chaz Bono, who was the daughter, well, is the biological daughter of Cher, believes she is a man, so now she is Chaz Bono. What is the treatment of this? The end would be surgery, surgical reassignment. Sonny was the husband of Cher, right? So any questions on this section? No, Sonny is dead. Chaz is the daughter. That's right. If you saw Dancing with the Stars, she was there, I think, a couple of years ago. No therapy, but not to change it. You got to go with what you believe you are. So that's what they try to do. We don't fix it by making you, if you're a biological boy but you think you're a girl, if you truly have this dysphoria, we fix it by making both parts equal. How to differentiate this from just want to call attention? It's going to be this, you're going to have to look at the history. They'll be very clear. What's the theory behind pedophilia? There's lots of theories. I mean, maybe these are individuals that see themselves in that stage as well. I mean, there's lots of reasons why people can do this. Tomboys, hold on. I don't want you to confuse the tomboy and the sissy, because those are very different things. Let me write it out for you. Hold on. Do not confuse tomboys and sissies as gender identity disorder. A tomboy is a girl that acts like a boy, and a sissy is a boy that acts like a girl, or a tomboy is a girl that has manly mannerisms or likes, and a sissy is a boy that has female mannerisms or likes. These do not necessarily have to be gender identity disorder or dysphoria. So a tomboy is a girl who knows she's a girl, so there's no disconnect. So the tomboy, let's do this way. The tomboy, girl sexual identity, girl gender identity, but when you look at the gender role, it's boy. That's what the tomboy is. No treatment, just leave him alone. And the sissy would be man, knows he's a man, but his gender role would probably be female. They can be. They can be heterosexual. Yeah, it changes. I mean, a lot of this, they just outgrow it. I mean, how many men do you know or have seen that seem to have more estrogen than women and they're married, and vice versa? So this is what this is basically. All right. So any questions? So I think we're going to call it quits for tonight. And we'll see you tomorrow at 6, and we're going to finish tomorrow, okay? An asexual person is just someone who doesn't care about sex. All right, take care and good night. See you tomorrow.